Yes, I would say that we have now two main group of drugs, new drugs. The first one is an old intervention that has changed its name from anti-aldosterons to mineralocorticoid receptor antagonist. This group of drugs has showed a solid evidence in preventing heart failure, mortality, heart failure hospitalization, etc. And the other group is the real new one that is already in the market, is what they call ARNI, angiotensin receptor neprilysin inhibitors, which is a dual inhibition of the renin-angiotensin aldosterone system. Entresto, the trademark, is a real advance in improving the outcomes, mainly mortality and heart failure hospitalization in patients with chronic heart failure. I would say that most of cardiologists around the world have been using AC inhibitors and angiotensin antagonists in the past 30 years or so. Now we have to change our mind to this new class of intervention because the scientific evidence showed by the results of clinical trials with these two groups of drugs is a real impact or has a real impact in clinical practice. So that is the main issue to be considered. Cardiologists might take in account that these new drugs are really improving the prognosis of chronic heart failure. Yes, I would say that there are many, but I will point out one group of drugs, which is called the SGLT2 inhibitors, that surprisingly has been produced as anti-diabetic drugs, but an initial trial demonstrated a clear benefit improving the outcomes, the cardiovascular outcomes, mainly mortality, heart failure hospitalization, myocardial infarction, etc. Now, due to this striking result, most of the sponsors are planning new mega trials using these drugs only in patients with heart failure. So the 1 million question is, are they going to demonstrate a great benefit in heart failure despite if the patients are diabetics or no? We don't know yet, and we are going to have the answer in a couple of more years.